My name is Benoit Glazer. I am a conductor and the artistic director of the Timucua Arts Foundation. I am here today with my lovely daughter, Dr. Camille Glazer, which is rare. And it's rare because she lives right now in Liverpool. I had to take this opportunity to talk to her about her experience. She battled acute myeloid leukemia in the spring of 2019. I want her to tell me everything.
So I have a bit of an unusual diagnosis story. I had just gone out to Thailand to do a 2-week externship. Not a very long trip at all. And a few days in, I developed quite a high fever, and I was in quite a lot of bone pain from that fever. So when it didn't resolve for a couple days, I decided to go get tested for dengue, because that was my primary concern, or possibly malaria. So I went to the hospital and they drew some blood to run those tests. And by pure chance, the doctor I had seen in the emergency department was a hematologist, and she ordered a complete blood count just as part of the blood test she ordered. And on that, they identified that my blood counts were extremely abnormal. So they held me overnight, did a bone marrow biopsy in the morning, and diagnosed me with leukemia. It's not the diagnosis you expect 4 days into a trip to Thailand, but yeah, that's how it began.
How long did it take to start your first treatment?
The diagnosis was confirmed in the morning, and I think that afternoon I had a bag of chemo hanging. They weren't sure I would survive the flight back to the UK, so we started induction chemo immediately.
And so you were in Thailand for a month. So the first treatment plus like a week or whatever to recover. And then you were flown back to the UK, and your subsequent treatments happened in the UK. Now, tell us a little bit about the most dire situations you found yourself in, during your treatment.
Yeah, there's a few. I think in Thailand, I had my induction chemo, which is the first cycle. It's usually the most intense because they're trying to actively fight the cancer that's raging within. And I think especially compared to American or British standards, the induction chemo I had in Thailand was especially intensive. Just their protocol there was a much higher dose of chemo than I would have received in other places. So that obviously ravages you quite badly. I was really ill once the chemo kicked in. I think a few days after the first week of treatment is when I started really feeling it. My blood counts went way down. I had a really severe bleed at one point. I went into severe blood loss. I went into shock from that. I had to have an emergency surgery to cauterize the vessels that were bleeding, and there was no time for anesthesia, so I was awake and could feel the procedure, which was really traumatic, but made it through that in Thailand, thankfully. And then obviously coming back to the UK, doing just further 3 cycles of chemo. They were much less intensive, but still really difficult. I had sepsis twice, went into acute respiratory failure, had to be placed on ventilators. It was a really long road to recovery. I developed almost every complication under the sun after one round of chemo or the other. But yeah, the sepsis and the hemorrhagic shock were probably the closest points, yeah.
August 2019, you had your makeup final exam. You did your doctorate, and so your treatment happened essentially between your 3rd and 4th year of your doctorate. Yeah. And you were able to pass your final exam in the hospital, which is amazing. Tell us a little bit about your plans.
Yeah, so I'm a vet by training, and I was able to finish vet school during the cancer treatment. I'm currently working on a PhD. I'm in a doctoral training fellowship, so I'm planning on researching and studying zoonotic diseases, diseases that move between animals and people in low-income contexts. So to help to reduce the burden of disease at the human-animal interface in especially vulnerable communities. I'm really grateful to be able to do that and pursue that, and to move to Malawi for a few years to do that. I'm very conscious that my cancer treatment kind of jeopardized this goal that I had. Very fortunate that I don't happen to have any particular genetic predispositions to leukemia. It was just a random occurrence, and so my risk of relapse was low enough that I didn't require a stem cell transplant, which would have precluded my ability to travel to these types of countries and work in these places. Yeah, everything's worked out now, but it was a bit dire for a while, and certainly cast doubt as to whether I would be able to accomplish these ambitions that I have had and that I've held for many years. But yeah, thankfully made it through that in a way that it's still possible.
So you plan eventually to work for an international organization like the WHO or something like that, because you're trying to improve the lot of humanity, and looks like you're on your way to do that.
Hopefully.
Which is great.
I think something that my doctors made very clear to me when I was diagnosed is that the cancer will kill you. Leukemia, especially acute leukemia, will kill you, and very quickly. But the treatment can also kill you. And in the case of leukemia, which is a very fairly common youth cancer, particularly, I think that's especially important because you have people that are diagnosed in childhood, or in my case, I was 23. And so these long-term side effects are going to affect me for the rest of my life, which is hopefully a long time. So it is quite a brutal treatment. Again, I wouldn't have refused the treatment because I knew what the circumstance was if I did that. But it is very hard to live with. It certainly can be.
It's important to find better treatments.
Yeah.
I mean, from my point of view, let no one have their kids go through that ever. So let's find a better treatment, guys.
Yeah, I think we can do it. Yeah, I think something that people sometimes forget is with blood cancers, leukemias, there's nothing to cut out. You can't have your, everything drained from you and replaced. So that's why it requires such intensive chemotherapy compared to other cancers, and why the treatments are so harsh and can be so difficult to survive in and of themselves. So I think any advances we make towards the drugs that are available, any complementary conjunctive treatments that we can develop will absolutely make a difference.
Thank you.